Good afternoon, everyone. Welcome to the first of a series of events from Oracle in the digital health space. We will do a separate set of these events for financial services in due course, but for the next few months, we're going to have a regular slot, probably on a Thursday night. We'll give you the dates at the end to refresh your memory, talking through with guests like my friends here, the various challenges of patient healthcare and how digital technology started to improve the life and the future prospects of patients. We will get into our guests and some questions based on a survey we've done over the last 2-3 weeks with hundreds of respondents. We've got some interesting things to share with you for the first time tonight. But first, I need to do a little bit of a sales pitch for why we're here. This is Oracle. We are developers, one of the UK's largest mobile agencies, and let me set the scene for this meetup tonight about why we are here. So, for any company invested in the life cycle of human health and well-being, patient experience has emerged as an important source of tangible competitive advantage. Recent advancements in health technology are empowering patients and practitioners, as our guests will tell you later on from both ends of that, to rethink the delivery of health services. The future lies no longer in the waiting room, but arguably in the cloud. So who are Oracle? My friends on the other side of the camera keeping me right here that we're all doing the right things tonight. Oracle creates solutions that make patients and healthcare professionals' lives better. We are the UK's leading mobile app web platform, emerging tech and cloud computing specialist. Our work for the healthcare industry has taken us to the leading edge of digital tech and the effective application of it in wellness and lifestyle support, medical technology, including devices and diagnostics, drug discovery, development and research, patient management and monitoring, efficiencies for providers, and even insurance. Our solutions are built and delivered in environments that are highly regulated and where data security is imperative. We work with visionary clients such as our friends here to design, develop and deliver digital solutions that positively impact the lives of patients and practitioners alike. Let me introduce our guests for the evening, and we're very grateful for their company and their support for the first of these, which, as you can see, is going to be a fairly informal fireside chat. We even got the fireplace rigged up and made the room a little bit warm. First of all, Alex Eavis, next to me here. Alex is the Chief Product Officer at Eavis Health, a large digital health company pioneering better information sharing in healthcare, whether that's access to detailed health and symptom information through the patient website or opening up access to community services through the highly rated Patient Access app. I believe you're at rated 4.7 from 500,000 reviews, which is unheard of. So credit to you for that. Alex's background has been described as changing the life of NHS patients with technology and data, and has a background of working in NHS trusts to improve the mental health of patients, notably at HMP Wandsworth. Is that correct?
First job out of uni, that one.
There you go. Providing
2 years in the clink.
I gather you were providing life skills teaching to the largest male prison cohort in the UK. Alex then went on to start 2 companies tackling independent living in the independent care sector, and then more efficient sharing of medical data at Dovetail, acquired by Eavis about 3 years ago. Alex recently described herself as enthusiastic about the potential to make a difference, and would like to think that people that join Eavis are also enthusiastic about that because it's super exciting. Alex, thank you and welcome tonight.
Thanks.
Pasha, to my left, is an academic clinical researcher at the National Institute of Health Research based at Imperial College in London, and at the same time works as a specialist registrar in vascular surgery. Am I correct so far? He graduated with a degree in medicine from Imperial and is a member of the Royal College of Surgeons of England. Having been awarded the Dean's Prize during postgraduate studies, he went on to complete a PhD, the results of which resulted in a patent filing and almost £1 million of funding for research into arterial disease. His primary interest is in translational research, with a particular focus on the digital health technologies and applications for arterial disease and diabetic foot disease. He currently works with the Hamlin Accelerator for Surgical Innovation with funding from the Wellcome Trust to develop a digital platform for the prevention and management of diabetic foot disease. Is there anything you don't do?
Oh, many things.
Welcome and thank you. Thank you for joining us tonight. 2 very well-versed guests for us this evening. I'm going to give you a bit of an icebreaker challenge, but don't respond straight away. And we invite you to give us answers through the Zoom chat or by Twitter at Oracle UK if you can. If there is one thing you could do in your life to improve the experience of patients through digital technology, what would it be? Now, let that percolate. And audience out there, please do have your say. We'll come back to that later and see if anything we talk about changes your mind. So keep that in mind, and we'll come back to it at the end. To start with, a recent survey, as we said, we conducted, 75% of respondents stated that ease of use was the most important element of using and adopting a health app. We'll start with you, Alex, because it's probably up your street to begin with. As the product officer of a highly reviewed application, as I said, do you agree, and what other elements do you feel are equally important?
I mean, totally. Usability is absolutely crucial. I think we're still somewhat behind in digital health, kind of other consumer technology, particularly where that's B2B software. One of my pet niggles is why are things that you use in your working jobs always so much more unusable than consumer technology. Other things really important when we're talking about health, obviously privacy, security, privacy by design is absolutely crucial these days, and what we really need to engender patient trust and use of those tools. And then probably accessibility is the last one. I think we sort of automatically swing to thinking about apps when actually, you mentioned patient access app, but actually still 50%, more than 50% of our users are still using the web app or a website on a desktop or a laptop computer rather than a phone. So that'd be my top three.
Pasha.
Yeah, I mean, I completely agree with everything Alex has just said. I think in terms of, it's interesting though. I mean, which side of the coin are we looking at? We're looking at from the sort of point of view of the healthcare providers or the patients. I think in terms of usability and accessibility, their needs are obviously slightly different, and so I think consideration or specific consideration needs to be given to each of those use cases because they are slightly different. I think in terms of sort of healthcare providers, obviously, speaking from personal experience and sort of for my colleagues as well, we spend hours on sort of electronic health record systems and various other software in the workplace to deliver care. And I think all those things have to be have to have all the appropriate usability criteria and everything, but also have to be accessible, obviously. But I think integration also comes into play as well. So, I think I probably use 7 to 10 different bits of software, and how do we integrate those to create a more compelling experience?
Why would it be, though, and either of you can jump on this, that we often talk at Waracle that health and wealth are analogous in that they are things people would rather not dwell on too much. So people think about pensions as something they worry about later on. And I think health kind of the same up to a point that people would rather just be healthy and worry about ill health when it comes. Why would it be that people are so happy to give up their privacy for something as trivial as Facebook, for example, or LinkedIn in the world of work, but wouldn't be for something really important like healthcare, where it actually benefits them more directly?
I mean, I'll take that. I think people need to understand the purpose. I've been in a conference room where the speaker actually said, who's concerned about sharing their data and, their medical data, everybody put their hand up. And then they said, right, imagine if you're sharing your data and the sharing of your data could save the life of your loved one who, has a difficult, a form of cancer that's untreatable. Suddenly, everybody is willing to share their data. And I think they found that they've done lots of patient juries and sort of patient engagement exercises. And I think the media might have a little bit of part to play in this, in the sort of scare stories and horror stories about sharing the data and the NHS wanting to sell your data, et cetera, et cetera. Actually, when you sit down and explain to people what the data is being used for, generally people are very supportive of that.
Mm. And people believe Facebook sell their data, but it doesn't put them off doing anything. I mean, by and large, they do believe that, but the usage never actually drops over time. It might bob and weave, but it doesn't really drop. What do you think, Pasha, about this?
Yeah, no, I think the difference between sort of Facebook and healthcare data is perhaps that healthcare is very private, right? There are things that you perhaps don't want to share about your health, and that perhaps some conditions that there might be some stigma attached to. So I think all of these sort of make it a very sort of sensitive topic. I think I can speak, from personal experience as well. I'm a doctor. I'm sort of working on an application that collects patient data. But at the same time, when the news broke out about NHS potentially selling our health data, I was also, I think my colleagues as well, they were very concerned. But I think Alex is right. I think you need to put all of this into context, and I think the sort of framing that you were talking about is really, really important, right? So adding that sort of example of, well, this is, and that level of transparency, or this is what we're going to be doing with this data. This is who we're going to be sharing it with. This is a potential good that can come out of using it. I think that sort of context and framing is really important.
Understand. A lot of the work we do at Oracle is in really sensitive research, and whether it's drug trials or other forms of laboratory research. And we find that people, as you say, if they're willing to, if they're told what the data is going to be used for and the likely benefit, we've got a chance that they'll stay with the program. So in terms of drug research, we find people, it's the same with any consumer app, to be honest, they drop out pretty quickly. So the job, as you'll find with your app, I'm sure, is to get people into a funnel and stop them falling out of it pretty quickly. Now, what sort of things do you think you could ask a patient to think about in terms of usability when they come into a health service to make them persist with it? Do you ask them, are you really upfront that we will collect data, but there's the benefit and that's what you're going to get? Or is it more simplistic than that? Try and make it really personal to them, that your health depends on something like that.
Yeah, that's a very difficult question. I think, I don't know if anyone's managed to get that quite right. I haven't seen any examples of anyway. But I think, through perhaps use cases, through examples of where data has resulted in some good, I think those sort of examples and case studies will perhaps be important in that, and sort of changing the mindset. But yeah, I think that's probably the key, I would say.
Yeah, I'd say it's the what's in it for me, or the what's in it for the people that I care about. I mean, I'd like to think that we are altruistic beings and that we want to help those around us. But I think you need to, the transparency is absolutely key, and you need to have that, that clear visibility of whatever I'm donating is producing value somewhere, and that, that value is patient outcomes, or it's monetary, but then I'm benefiting in a monetary way from it. I just, it's the visibility. I think too much, you just don't see what happens with it. And I think that's what people get concerned about.
Yeah, no, I think that's interesting, because we were talking about sort of NFTs before, right?
Yep.
So, what's sort of stopping patients from actually seeing a monetary benefit from other companies using their data? I mean, this is just sort of, a very much a sort of sidestepping and talking about something on a tangent, but what if a patient's data could be as part of a non-fungible token that they could have ownership of, and yes, the companies can use it, but they see monetary benefit from it. These are sort of interesting concepts to think about, trying to make data sharing attractive to patients.
Or even a ledger that records every step of viewing or using data along the way. So at least you've got the ledger recording of what's happened to it, and you can see that as a personal journey. There's nothing really wrong with that. It's almost like tracking a parcel in a rudimentary way. But if that's the sort of things that make people more aware of it. The other side of the fence, I'm sure you're more curious about this than most, but the world of technology is largely driven these days by network effects and two-sided marketplaces. So we've talked about how people might persist with something once they start to use it and get the benefit. How do you attract them to use digital healthcare in the first place? So in the world of apps, by and large, star ratings and things like that, you've got a very good one. Others don't. How do you attract people into digital healthcare in the first place? I remember an example of somebody pitching on Dragon's Den years ago, who had a two-sided marketplace for cosmetic surgery. And the investors completely balked at it, at even the thought that you might rate a doctor. And an application which allows you to rate doctors so free and easily. And then the whole point of the technology was to enable the marketplace. And that's the digital entry point, not so much that there is data being exchanged to help your particular health, but it's a way of improving people's outcomes in a way. What do you think about attracting people to marketplaces like that to begin with?
I think it probably has more application in the wellness space than the sickness space. I think in the sickness space, you know, we still are in a quite paternalistic healthcare system, and that people have a lot of trust in their clinicians. I don't think clinicians are yet necessarily, and not any fault of their own, but necessarily embracing or have ways to prescribe digital health tools. That may be different in secondary care. I speak largely with a kind of pharmacy and primary care focus. I don't know what you think.
Yeah, it's interesting. I think in terms of even B2B software, traditionally it's been very much from sort of a top-down sort of approach, hasn't it? Sort of targeting you know, the company owner or the healthcare provider, for example, in this particular context. But more and more we've seen sort of B2B software essentially being spread by a network effect from the bottom up. And so and I'm yet to see a sort of a healthcare example of that where that's worked well. But it would be interesting to see if that's something that we could sort of harness in sort of the healthcare sector. Can we create, you know, for some software that spreads via the network effect from the bottom up?
I'm going to move on to a different question, but before I do, we had one supplementary that came to us. So how do you keep patients engaged throughout their lifetime in a health journey? So it builds on the things we've talked about, assuming people do engage with these things. How do you keep them engaged as their health and their life develops over time by the use of technology, presumably?
It's a very tough question.
Yeah, these are indeed. I think connectivity is really important. We have such like rare touch points really with the healthcare system throughout your lifetime. And at the moment, there's very little feedback loop. So if I walk into my GP, I've got a problem, they give me usually some medication, and the GP assumes that the GP assumes I'm fine and that the medication worked because I don't go back into the GP again. And only if I do, I think that, you know, only if I do have I then got, you know, another touch point with the healthcare system. And I think it's that feedback loop that not only sort of drives improvement in healthcare, but also drives that engagement and sort of self-care preventative agenda as well from me as an individual. And it comes down to that personal health record thing as well, you know, not only my medical record, but am I bringing my, you know, my Apple Health record and my sort of social determinants of health and, you know, everything together. I think once people have that and they can see, again, not just a view of it, it's like sort of early days of online banking, you know, I just can see my bank, but then the apps and the things that you can do with it start to get built on top of that. That will become a much more sort of powerful, holistic offering.
Yeah, I think also, I guess, through a lot of these sort of healthcare interventions, what we're trying to do is sort of engage patients through their sort of journey from, you know, whether that's over the course of a particular condition or whether it's through their lifetime. I think this is a sort of very, very challenging topic. I can talk slightly from sort of personal experience. A few years ago, this is sort of back in 2012, when initially people started using wearable devices like the Nike Fuel bands. We thought it would be a very sort of neat application of it in patients with poor circulation. So you can encourage them to walk and encourage them to go out and exercise and keep them out of hospital. And it worked really well. So our data showed that sort of the patients who were using this particular wearable device over the first 6 months, you know, their walking distances doubled and they were really enjoying using it. But then we saw that sort of when we followed them up for up to 12 months, but around 6 to 12 months, their walking distances plateaued, their engagement with the apps plateaued. I think we've come a long way since then in terms of how do we incorporate sort of behavioral tools and behavioral modification tools that keep patients engaged with exercises like that, and, you know, monitoring your step count or activity. But I think there's still a long way to go. And I think this is the problem with a lot of sort of current devices in the market, and that it doesn't engage patients for long enough. So I think we need to be creative about what kind of behavioral modification tools and exercises we are incorporating to engage patients for longer.
I tell my favorite story at this point. Last year, I lost quite a bit of weight. It was about 3 stone off. A bit's come back on since, forgive me. But I used a food tracking app, and Nicole in the background's heard this story before. I think she's laughing already. But it told me on one particular day that I lose more weight when I eat sausages. And if there's any stimulus to help you diet, it's to tell you to eat sausages. And I've kept that in my head. And now, what it's actually telling me, really, I would imagine, is I overcompensate on the days I eat sausages. Therefore, I behave the rest of the day. So I'm allowing myself the time to do it. But at the same time, exercise, Apple Watch was telling me my VO2 was going up every day. And they're actual tangible things. You could correlate how you feel to these little triggers it was giving you. And the encouragement from doing that is quite something. So I can see how it might work in practice. Before we move on, I left you a little bit of an icebreaker at the start. What came into your head as the first thing you would do to improve the patient experience if you had the choice? You've forgotten I asked now,
Yeah.
Let's come back to it. That's very unfair. Before we go on, just in case anybody has to drop off a little bit early, I'll give you the dates for the next of these meetups that we're holding. 27th of January is the next one on empowering patients. 10th of March on evolving research, and we're doing a bit of work on that in the background at Oracle just now, so that's a very interesting thing to present back to you. 21st of April on inclusion and accessibility, which are things we've touched on here already, but we'll dive into that in a lot more detail. And equally, 26th of May on the value of data, which will come up all through this. Next thing from our survey, Pasha, I'm going to throw this one at you if you don't mind. In our survey, 90% of respondents had never been recommended technology by a healthcare professional. Do you think there's a disconnect between innovation in the market and the healthcare professionals who have a direct relationship with patients? And if so, what can be better done to educate clinicians in the use of technology?
Yeah, I think, I can hold my hands up and say that probably I fall into that category sometimes, even as someone who is particularly interested in this sort of this sector. I think education definitely falls into it. And when I was an undergraduate, for example, there was no teaching about the benefits of digital health because it probably it didn't really exist to the degree it does at the moment. So I think education is important, and sort of the earlier you start, the better. But I think there's a sort of a bigger issue here, and that's that a lot of current innovation really doesn't have sort of the quality and level of evidence that you need in order to be able to sort of recommend it to your patients. And so I think in terms of, for people who are developing healthcare interventions, they need to have one eye at all times on, how are we going to validate this in clinical practice? How are we going to get high quality evidence to try to support this? So I think that's really important. And if we achieve that, then hopefully the rest will sort of follow.
Yeah, it's I mean, there's companies like Orca that's run by Liz Ashall-Payne, who do sort of accreditation of digital health apps, but people should not underestimate the cost and the time it takes to create something that's clinically validated. And I think part of it is also sort of the business model behind it. So at the moment, there isn't necessarily a really good sort of remuneration model. I don't think the NHS has necessarily worked out exactly how to remunerate sort of the digital health providers in a way that sort of accounts for that huge investment that it takes. So unfortunately, a lot of the more successful digital health companies have gone international first. And sort of because it's, you need 5 years runway to really make a difference and be financially sustainable just selling in the UK markets, which is a shame because we've got a bit of a brain drain, I think, of really amazing, potentially amazing tools overseas. Especially you look at some of the, I think the Big Health is one they do, sort of mental health apps, Sleepio, and I can't remember what the other one's called, the anxiety one, but they have significant advantages over the pharmacological equivalents, and still there's quite low traction, I would say.
Is there a gap though between the sort of things that a GP might end up prescribing one day, whereas actually prescribing a piece of software, patient access, for example, which might serve something to the patient to devolve the care to the home almost, rather than a nurse taking a blood test, you do it yourself. To the other end of the market, where it might be some community care could prescribe something like Sleepio, which and where we come from in Scotland, that's like start to happen. I think NHS staff have been given Sleepio as a wellness tool for themselves. So is there an easier entry point for things that aren't quite clinically certified, which some of these apps may not need to be, and the other end, which will need years of practice and clinical care and approval before they get to that point?
Yeah, and maybe the integrated care systems where, you know, we're moving towards a sort of more community provided, hopefully connected service. We're seeing a lot more triage now into, you know, out of primary care into, say, community pharmacy. And I think we'll see that more sort of locally configurable kind of extensible referrals networks. And I would like to think that social prescribing and digital health prescribing kind of becomes part of that. Yeah, I mean, absolutely depends, but you know, we're in a market where you can't fail fast, you know, agile tech, fail fast, just get it out there when it's good enough. You can't do that in healthcare because it kills people. So it's always a tricky one, isn't it? The balance between, you know, getting things out there that are proven to work and that the clinicians can believe in. You know, we don't want to go to the other extreme of, you know, how long does it take to get a drug to market? 10 years plus and billions of pounds. You know, there's got to be a happy medium. I think the MHRA are getting there with like medical device regulation, etc. But it feels like we're still quite at the beginning of the journey to me.
But then, sorry, Pasha, before you jump in a world where we've just seen a vaccine developed in months, is there actually the will and is it the finance that would get us over that big leap from things taking years, which they used to do, to actually tangibly things not taking years when they're important? Could we just decide something that's important enough to prove it could be done outside of an emergency?
Yeah, I think that's the thing, isn't it? Trying to find something that is important enough. Clearly, you know, the pandemic was important enough, and I think everyone had to sort of rally together, and we had to adapt to try to get these vaccines through as quickly as possible. But I think to your point, you know, I'm sure there are quicker ways that we can get these things like sleeping apps, etc., to the market and in front of patients. But then it depends on, you know, which device category your innovation falls under. So if it's something that's relatively low risk, then yeah, absolutely, you can get that through faster. But you know, if it's something that carries a lot more risk, then it's going to take years and years. I think to Alex's point, it's really interesting because it sort of echoes a lot of the conversations that I've had recently around sort of development and you know, where are you going to sell this product essentially. And the general advice seems to be, and it's sort of unfortunate, but you know, you validate in the NHS and you sell abroad, which is, you know, it's you'd hope that in the next few years that's something that we can sort of work on changing, and how can we get things implemented into the NHS quicker. Yeah. Without
getting into politics, because I'm going to try really hard not to. We've seen things like the DIGA standard in Germany, which is well defined, it's huge, but it's actually not that different than the sort of things you do to be approved for the Apple Store, believe it or not. There's an awful lot of common usability questions. There are clinical things too, but the digital app end of it is actually quite standard for the things we do. But it's well defined and it's clearly been well thought through. Why does the UK not have that sort of level of prescribable tech yet? Is it just, as you say, we're not as agile as other countries? Because clearly we've got the technologists. Is there anything culturally in this country, politically, that stops us from doing it? Maybe not politically.
I think standards-wise, we're getting there. The NHS released something called DTAC, the Digital Technology Assessment Criteria, which is actually relatively low bar for, well, I shouldn't say low bar. It is self-certified. It's not, you know, it's not unachievable from small companies. So from a standards perspective, we're there. From a procurement perspective, you know, I think people come in, innovators come in thinking that the NHS is a customer, and we all know it's like thousands or tens of thousands, depending on which bit of it you're trying to sell into. So yeah, I think there's a few challenges there.
Yeah, no, I agree. I mean, I think Alex has obviously clearly a lot more insight into this sort of area in terms of procurement than I do. But I think the difference is, particularly in places like the US, it's just much more of a competitive market. And if you're agile and nimble, then you can do well. Particularly, especially if you have the right evidence and sort of data.
Question that's supplementary and slightly on a tangent, but we'll go with it. Does the wellbeing app world push the responsibility for patient health from the endpoint provider to the individual?
I think this is a point I was going to touch on earlier when you were talking about sort of clinicians prescribing apps. I think there definitely has been a trend towards consumers buying wellness apps. So for how long are we even going to be needing to tell our patients to use a particular app? I think they're going to be going out and finding it themselves. You probably you see this already in places like the US, where you have massive billboards advertising pharmaceutical products. But I think we are sort of at a very early stage, and I can definitely see this shift. And a lot of the times I see patients coming in and already they've taken the initiative to use wearables and various different dieting apps and everything else. And I think that's just going to continue. That's going to be a trend that continues.
Yeah, I suppose my concern is that it's a bit self-selecting. So, fitness apps are probably the most popular, wellness apps. Oh, I've got that frog.
It's one of these times to give the frog a
Yeah.
chance.
So it's probably the people that need it the least that use it the most. That would be my concern. And I think it's probably a bit, going back to the patient engagement piece as well, the people that are hardest to reach and hardest to engage are often the ones that need it the most. And going back to the question that we'd all forgot you asked at the same time, I think that was mine. The thing that totally that sprang to mind initially was was digital inclusion and accessibility, both to sort of devices and literacy as well from a digital perspective.
There was a slightly different way to think about this that I saw. It wasn't in our survey, it was in a different one a few months ago I saw. But in terms of people suffering from mental health problems, I'm not going to say disorders, but problems, overuse of digital products was the root cause. I think it might have been 50% or thereabouts. So do we actually give ourselves a problem, given that, as you say, it's likely to be self-selecting, that people who will dwell on these apps and get almost addicted to them may be the people least aligned to them in the first place? Is that storing up trouble potentially?
Yeah, potentially. I think we've all seen sort of some of the detrimental effects of sort of social apps in particular. And certainly I see my patients accessing electronic health records, their own records more and more, and coming to me with sort of already equipped with all the information that they need. I have to say the majority, I think, have a healthy relationship with it. But there are a minority who do tend to obsess on, one particular blood test result, for example, and they'll be continuously checking the results. It's interesting. I think it's a difficult problem I think that is the minority. That's the first thing to stress. And I think it is a difficult problem to address. But this is where we need this sort of feedback, and we need this data to be able to sort of put measures in place to stop things like that early on and support patients who may need it via these applications, for example. Yeah.
I'd like to think if people can get addicted to social media, they can get addicted to wellness, and that maybe we should use some of those tools that we use in consumer tech to make people buy the pink shirt with a dog on it to go out and run, or to monitor their glucose better, or whatever it is. So hopefully it's a force. It can be utilized as a force for good, or digital addiction.
We actually have a related Bless you. A related question came to us. It's along the same lines to what you just said. So it seems like healthcare benefits from non-standard data sets. Do you think people would feel different about sharing data when related to things like reaction times, audio files, and so on? Now, that speaks to the sort of signals you give on social media when you say you look at 10 pictures of pink shirts, you'll start to be offered more of them to buy. So is there something in that the sort of consumer signals, and we'll delve into this a bit more in a minute, that people use naturally elsewhere do have a place in healthcare without being too flippant about it?
Definitely. I think that's this is a very interesting area. One of my colleagues is sort of very interested in this as well, has been doing some work around it. But Alex is involved with sort of delivering patient health information via the patient website, and it's interesting because I think what people would really benefit from is having patient information delivered to them that is sort of specific to their needs, is what they're looking for, but perhaps even in the right format. So, some visual learners, some like to sort of read, some people like to watch videos. Can we use this sort of data that you're referring to deliver the right information in the right sort of way to the person who needs it?
Yeah, I mean, we're just starting the kind of personalization journey. So, I mean, it's interesting that you said, so, traditionally, they're called pills and dills, the patient information leaflets. You'd go, and when you got a new medication, GP would print out your do's and don'ts of the medication. And the early phase one of the personalization, like, I know once you've opted in, yeah, you're happy for me to provide personalized information around your medication that can support you to take it better, and adhere to the course, etc., etc. But yes, going then the next step is, well, do I, we all engage with video content better now, not, big written things that we have to read. Is there forums? We find forums are very popular, sort of communities of interest around your condition and your medication, etc. I mean, I think that's only, again, we're just at the start of the journey there, but absolutely.
When what you're talking about there is digitalizing something like Weight Watchers, where a community turns up once a week to watch each other's progress, and it's not that different. It's just finding a better way to do it, potentially in the home. Next question then. We'll move on to a slight tangent, but it's all related. So telemedicine has been a hot topic in the wake of the pandemic, yet in our recent survey, 25% of respondents chose video consultation as their preferred method of communication with health services, even though 79% of those respondents were under 45. Do you think telemedicine will remain as popular in a non-socially distanced society, and for what reason? And as a supplementary, do you think telemedicine still has some way to go? Could you see a future where it's supplemented by other tech, similar to the things we've just said, other sensors, signals, or even artificial intelligence, which may help people to look after themselves? Pasha, why don't you take that?
Yeah, I think telemedicine's definitely here to stay. I am still very much a big fan of sort of face-to-face consultations. I think they both have sort of their pros and cons. I think that the sort of challenge with sort of these telemedicine consultations sometimes is it's very difficult to sort of build rapport with the patient, because a lot of the sort of non-verbal cues are lost, and you can't necessarily examine a patient, which of course is an important part of thorough assessment. And I think that's what sort of patients want as well. But at the same time, I don't think we need it all the time, on every single episode of the patient's journey. So I think it very much depends on, where the patient is at their journey. For example, if I have a patient who needs a high-risk operation, I would like to see them face to face to discuss those risks, because I feel like you can have a sort of more engaging conversation that way. But at the same time, if they are waiting for their investigation results, and the investigation results have just come back, I can easily have that conversation with them over telemedicine. But sort of to the second point, so in the second question, it's interesting because I think definitely some of this virtual reality and augmented reality, etc., will certainly be helpful in trying to sort of bridge that gap, and trying to sort of create a more immersive experience where you can feel like you're sitting in a consultation. I don't know if you'd want to, but you know, I think it would go a long way to sort of addressing some of those initial barriers that sort of I discussed.
And some technologies has already landed here. So I know, I think it's more in England and Scotland, but when the hospitals got really busy last winter with coronavirus, some people were sent home with oxygen meters that they could phone in every day with some progress, which saved them having to go in or even stay in the hospital. So that's already a slight use of reasonably rudimentary technology that doesn't have a sensory part. It's not feeding data live, it's just something that changes over time. That's the sort of thing that could kickstart some changes in behavior.
Yeah, no, definitely. I'm aware of a few of those sort of applications of wearables and Internet of Things and you know, telemedicine being evaluated in various places. And I think in Imperial we've sort of led some of that as well. And also other applications of that are patients who, for example, just had an operation. I think with that sort of technology, you can get patients out of hospital quicker, so you reduce their length of stay. But also because you can afford to follow them up for a longer period of time, you can perhaps pick up problems earlier when they do arise, and get them the right information, and that will hopefully prevent, you know, reduce clinical complications and adverse outcomes, but also reduce the amounts of times they have to go to the emergency department because they don't have the relevant support. So yeah, I think it's interesting.
Yeah, I mean, I think it's important, you know, clinicians' time is precious and they should be spending it face-to-face time, and they should be spending it firstly on the right patients. So, you know, using triage tools and AI to direct patients to the right services and the right people is really important. And making sure that the time that then clinicians do have with patients is really quality. So they're not sitting and looking at a computer screen, but they're able to interact. So I think there'll be some new technologies, you know, the voice to kind of coded text technologies that sort of landing, you know, becoming more of a reality will be really important. But ultimately it's down, you know, back to the sort of the digital front door telemedicine piece, you know, it's choice, right? Enabling choice. Actually the big shift wasn't necessarily to video appointments, it was to phone appointments, believe it or not. That was the biggest shift we saw. And that was actually the preference for a lot of people. And yeah, I think it's that sort of omni-channel route into healthcare that's here to stay for sure.
We have a supplementary, then thank you for sending in questions to us today. Do you think consumer communication could move from video to chat, such as WhatsApp? Embarrassing ailments would almost certainly be easier to discuss without voice and video. Who wants that one?
I mean, yes, absolutely. I mean, why not? Yeah, it's an interesting one in whether that would all, I'm just thinking of, would that all be stored on the patient record? God, that would make it messy. I automatically went to EHR, but it would, yeah, it would be an interesting one, because that would all then be auditable and, you know, not at the discretion of the clinician on what they choose to then write down. So yeah, I can see particularly in areas where there is stigma that might be preferable, that you don't want to, that would be less awkward.
It's funny you say that. Sorry, Pasha, before you answer this one. The major tech companies, when they get into these things, have to be able to offer an audit for anything that's said in a conversation like that, even though they might only mine an intent to say this person has had a conversation with potentially a provider who they might be speaking to directly, and the provider can tell from the words that it's a particular concern. The full transcript has to be available, so the context's available to whoever needs to see it afterwards. Just as you say, it's not just that you can tell what they want, there has to be more of a journey to it for an audit trail. Pasha, what do you think?
Probably, I mean, that's probably good for the patient as well, because they can revisit the conversation. I mean, that's just another angle to that. But yeah, I think, you know, things like that probably already exist in some formats, you know, in terms of AI chatbots, for example. But you know, my concern would be how this is. It sounds like it's going to be a lot more time consuming in terms of the amount of work that's required from the clinician. So there are some challenges there, definitely.
I have a good story. I'm not going to name the provider, but there is an AI chatbot in the world that I used in the beta phase, which on telling it I had a sore throat and getting into conversation, eventually asked me to take a picture of the insides of my trousers. And I've never quite figured that one out, but it does show where the intents start to go wrong. We do have one more slight supplementary on this. And again, thank you for sending it in. The short version of this is, based on everything we've just said, does the panel think engaging patients with digital health may address patient motivation through age, language, and cultural barriers, as well as the actual clinical need?
I mean, I think this is sort of part of the, it's interesting because if you look at sort of the World Health Organization's definition of digital tech, it is, high quality care for everyone, right? So I think that's definitely on the agenda. Alex touched on some concerns and issues around health inequality with digital technology. I think we need to sort of be very cognizant of that. But it definitely does have the potential to deliver high quality care for everybody and sort of reduce a lot of this health inequality that we're currently experiencing, if handled in the right way.
Alex? Yeah, I mean, most websites now can have accessibility plugins that do language, things for visually and orally impaired people. So, I'd like to think age is probably actually the most challenging one in many ways, and digital literacy, although I'm thinking of a pilot that we did in Bradford when I was Dovetail, our first kind of looking at connecting healthcare data, and it was for diabetes, and it was amazing the number of people who turned up with their children, who both translated, had the smartphone, did all the passwords, and it was nice, that sort of family effect. So even if they were digitally illiterate themselves, and also non-English speaking, that family came together to solve that problem. But obviously there are still people that don't have that, and they shouldn't be excluded.
Good, thank you both very much. Next point in our survey, and I think this is split in half, so I'll tackle it in two stages. Patient records. It's slightly back to a theme we covered earlier on, but in a bit more depth. When asked about improvements to GP and medical surveys, a common theme along the lines became being able to book and track history online or in-app, and having a record so you don't have to go through the same questions on each visit. So it kind of relates to the thing we just talked about, of having some sort of pathway and audit trail for the clinician to see. When accessing patients' records and results, do you foresee a personalized app, for example, where patients can view their own health profile, including results past and present, and physiological readings from any checkups they've had?
Yeah, I think that already sort of exists in many places. I know in Northwest Thames, London, certainly we're using the sort of patient knows best software, and that gives all of our patients access to their own health records, including clinic letters and blood test investigation reports and so on. And that's had quite a sort of good engagement. I think the last I checked, over 100,000 people in Northwest Thames, London, were sort of using that. So yeah, and I think engagement has been very good, and like I said, it's been great to see how that translates into better conversations when you see patients, because there's not so much sort of information asymmetry. They come already equipped with their blood results and reports of their investigations, and so you can have a much higher level conversation.
Yeah, I mean, totally. I mean, any user of the it's called PFS, Patient Facing Services API, which is a sort of NHS digital provided tool, should have access to their medical record. And that was the amount of data they were available to see was at the discretion of your particular practice and GP. But actually now that's being mandated that I think from January, you will be able to see all information in your medical record from this point forward, regardless. I think what's lacking is still that nobody's quite conquered what I call a PHR, personal health record, in that bringing together your formal medical record with your data that you want to enter from any app you choose to do, And then also, so I think that's the sort of first stage, is connecting everything together. I suppose a bit what Apple Health is trying to do. But then what next, right? So I've got all my data together. Well, I want to see, you know, my blood test results from last year. Oh, and I've done this, this, and this, and I've taken these steps. I've, you know, used this health app and whatever, and it's produced this result or not. And then actually getting a clinician's opinion on, you know, what else I'd need to do to continue my, you know, continue on that journey or that positive. I think it's the connectivity and the clinicians prompting you, and also saying, you know, the output and the outcomes of changing your behavior or the medication that you take or the digital health tool that you use.
That's important. Sorry, Pasha, please go on.
No, it's an interesting point, I think, in terms of, like, you know, uploading your own data, but there's probably a step missing there, isn't there, somewhere? Because, like you said, I don't think GPs have the time to be able to sift through and interpret data from all these different wearable devices that you have, for example. So I think it's a good application of AI. You know, this is something, there's a middle step that interprets and gives you know, a decision support algorithm that gives a recommendation to the GP of, you know, this has been flagged as with a warning sign, this should be investigated further. Sorry, Dave.
Pardon me. I was going to say there's a correlation, again, like we said at the start, between this sort of discussion and wealth. So the thing we find in wealth management is the thing companies miss is a single customer view of everything people are doing. So if you treat your day-to-day wealth as important, you can then build that customer view that eventually, if you behave, you'll have a pension, which many people don't. And although that's been regulated slightly to make people sort of forced to have a pension, they still have to find the money to put in it. So analogous to that in health, can you see the point that somebody personally has a single customer view of their own healthcare, potentially share out to a provider who may suggest or augment it, that they can see the direct benefits based on learning of some kind, that their behavior will actually have an outcome, all things being equal?
Yeah. I mean, open banking, what open banking did for the finance industry is, I mean, exactly what I think the sort of common standards and the interoperability and the things that are happening now should do for the healthcare industry. We're just 10 years behind.
Yeah, no, I agree. I think, you know, the patient should be the custodian of their own data. They should be able to go to any healthcare provider and say, you know, this is my patient profile. And they should have control of that. They should be at the center of their care. Yeah.
We've got another question to build on this. And again, thank you for sending these in. Does the panel see value in the consolidation of data sets captured direct from patients, along the lines of the things you're trying to do, Pasha, captured properly and consistently to present evidence of treatment outcome across patient profiles with different medication?
Sorry, so the question was patients collecting their own data and that being utilized by...
I think it's a data question. So if you're capturing data sets from different cohorts of patients, different levels of medication, can you see the value in consolidating those if they've been collected consistently enough to build a picture of treatment outcomes across those different profiles? Is there value in...
It's a bit of a, I think it's called real world evidence, and the kind of phase 4 studies that the life science industry do of, like, you know, you release your drug into the wild, and then actually you've got to prove that it does what it says it does when it's not in a nice controlled phase 3 environment, but people are going off and drinking 20 pints on the weekend and doing what they tend to do. So yeah, absolutely. I think actually the NHS is moving towards a sort of more an outcomes-based pricing model, which is great, not just buying drugs, you know, but actually going, right, you've got to evidence that. They've done that with Novartis for a new drug called inclisiran, which I think is a cholesterol lowering drug, which is pretty the first one, sort of groundbreaking sort of business model that they've done. So I think it's going to become an increasing requirement to go, okay, yes, drug company, I will pay you, but you've got to evidence that you've saved me a huge amount of money by making people healthier and by them having better patient outcomes. Yeah.
Building on that slightly, what impact does digital health provide in managing chronic illness, which is really the thing you're trying to avoid by building up that single customer view and lifetime angle? What benefits can we provide there?
Yeah, I mean, it's a very important topic. Chronic illness is accounts for, the majority of deaths globally. But it is a very complicated thing to try to address. A lot of patients with sort of chronic illness have multi-morbidities. They have a number of chronic illnesses, which in each of those are sort of multiple etiology. The etiology is very complicated and multiple factors have to be taken into account. They're often looked after by different specialties who work in silos across primary and secondary care. And then often there's, behavioral and socioeconomic factors that you have to consider. And I think digital plays a very important role in this particular area, because clearly the traditional health models that we've used haven't been successful in managing chronic disease. So you've seen prevalence, the prevalence of diabetes and cardiovascular disease are all rapidly on the rise, and that's because traditional models are not equipped to deal with them. And I think as the prevalence rises, it becomes even more compounded, all those difficulties. So I think where digital would be really beneficial and will have the highest value in treating chronic conditions is trying to get us to change the traditional care models into something different, reimagining the care models that we're currently using. It's interesting again because I think I see, working in secondary care, I see lots of teams delivering outstanding service, but the issue is that that's not scalable. But I think digital has the potential to deliver very effective holistic intervention on a sort of global basis at scale.
Do you think it has a role to play in, sorry, I'm now asking the questions, but as you're the expert, do you think it has a role to play also in kind of early diagnosis and earlier interventions? Because kind of once you've hit that multiple comorbidities, it's
too late.
It's too late. Yeah.
Yeah, no, absolutely. I think definitely in terms of prevention, early diagnosis, all of these are important sort of areas in a patient journey that digital is going to have a huge impact on. But I think that in terms of sort of clinical practice, dealing with these chronic conditions is particularly challenging. So it'll be interesting to see how we can sort of integrate the different parts of treatment that goes into managing patients with chronic conditions into something that's sort of holistic and can scale.
We have one more question to lob in along the same lines of these, again, about the patient records and the customer view that we talked about. So if stored in a central fashion, does that create a single point of failure that the health industry can't afford? Maybe blockchains or something along these lines is the answer.
Yeah, I mean, I think it's unlikely that we're going to have, they've tried to do it multiple times and it's not been awfully successful, that we're ever going to have a centralized store of medical record data. It's much more likely to be, I think, a sort of a federated model and as you said, a sort of patient controlled version of the truth. So yeah, what I'm encouraged by is that I think we're moving, the Department for Health and Social Care in its new sort of Data Saves Lives paper said data will not be duplicated, sort of stated that as a statement of intent. And I think that's quite important, because at the moment you would be terrified how many thousands of copies of your medical records are stored in different data warehouses around the UK, and actually, you don't need to keep copying it and storing it and defending it. That actually there's probably an argument to say bring the analytics and the questions and to the data rather than keep copying it and sending it everywhere.
Yeah, no, I agree with that. There's been sort of discussions many times about having multiple sources of data collection, but actually having that pulled into one central sort of database. And I agree with you. I think that's sort of a risky endeavor. I think also it probably can sort of affect sort of innovation. So if, for example, as a company, you're collecting data about a particular disease, you'll be able to use that data to essentially create predictive algorithms and decision support algorithms. And so there is the incentive there to innovate and develop platforms that can collect user specific data like that, and you can contribute these sort of algorithms to healthcare. So I think, yeah, it's a multifaceted sort of problem. Interesting.
Excellent. Thank you. Before we go, we've got a couple of minutes left. I asked you a question at the start, but you've probably still forgotten. But in a minute or less, could you describe, let's say it's 2035, you had infinite money and political support and time. What would you do with it to benefit the patient experience with digital technology?
I'll let Pasha go.
It's actually done. No, I think we've touched on this, so I'm going to wing this. So I think we've sort of touched on this a number of times sort of during this conversation, and that's sort of the patient journey. But the patient journey is very different for each of us, and depending on background, language, culture, which country you're in, what access you have to, what resources you have access to. So I think if you can develop a tool which truly supports the patient from their first health encounter throughout their life, and by support, what I mean is, you give them the right information at the right time, the right format, in the right language, that's right, that's personalized to them. It's sort of, I guess, what I'm describing is like a health trainer, isn't it? Sort of like a virtual assistant or support tool that can help you through your patient journey. I think that would be really valuable.
So the Alexa for healthcare.
Alexa for healthcare.
There you go.
Yeah. I mean, I can't really improve on that, but that's a cop out. But yeah, I think doing that, having that, but sort of from a lifetime view, and maybe not the dreaded patient word, that's just, we're all patients, but we also hope that we're never patients, that becomes your sort of your health assistant would be quite amazing. And I mean it's crucial, the data piece, liberating the data piece is absolutely like crucial to that, because it needs to be personalized, and we're moving towards personalized medicine, certainly for some conditions, but the earlier you have that information, the more you can do, and the more informed you are, the more steps you can take to prevent it in the first place. I was one of those idiots that did the paid 23andMe to sell my data very early on. Straight away, I'll spit in the jar because I want to know my genetics. But I had, I think probably the most interesting thing was they said, oh, you've got one of the genetic mutations that predisposes you to Alzheimer's. Some people, you had to unlock it because obviously some people didn't want to know or wouldn't want to know. But actually, I think that's, it's really useful. I would like to know that about everything, whether it's genetic or anything else, what predisposes me to things and what measures I can take, and what I can do in my life to make me have a better journey, live longer, happier, weller.
I think together what we describe as a super app for health.
There you go. Can you build one of those, please?
We'll certainly try. Our time is at an end, an hour and 3 minutes. Sorry, we've gone a little bit over, but we lost track of time. It's flown past. We're indebted to Pasha and Alex for joining us today. Thanks so much for your thoughts and for the audience sending the questions in. As we said earlier on, our next of these series will be Empowering Patients on the 27th of January. We'd love to see you there. We'd also love to see you at Waracle UK on social media, and please drop by waracle.com to hear more about what we do if this was interesting to you. But thank you all for joining us, and hopefully see you next time.